Clonidine tablets are indicated for the treatment of hypertension, alone or in combination with other medications. An extended release tablet of clonidine is indicated for the treatment of ADHD, either alone or in combination with other medications. Clonidine is also used for the diagnosis of pheochromocytoma, treatment of nicotine dependence, and opioid withdrawal. Before taking this medicine, you should not take this medicine if you are allergic to clonidine. To make sure clonidine is safe for you, tell a doctor if you have heart disease or severe coronary artery disease, a heart disorder, slow heartbeats, high or low blood pressure, or a history of fainting in spells, a heart attack or stroke, pheochromocytoma, tumor of the adrenal gland, kidney disease, or if you have ever had an allergic reaction to Catapris TTS, transdermal skin patch. It is not known if clonidine will harm an unborn baby. Tell a doctor if you are pregnant or plan to become pregnant. Clonidine may affect fertility in men or women. Pregnancy could be harder to achieve while either parent is using this medicine. If you are breastfeeding, tell a doctor if you notice somnolence, tiredness, rapid breathing, and poor feeding in the nursing baby. How to use: usual adult dose for hypertension. Oral. Initial dose 0.1 mg orally 2 times a day, morning and bedtime. Titration. Increments of 0.1 mg orally per day may be made at weekly intervals to desired response. Maintenance dose 0.2 to 0.6 mg orally per day in divided doses. Maximum dose 2.4 mg orally per day in divided doses. Usual pediatric dose for attention difficult disorder. Extended release 6 years and older. Initial dose 0.1 mg orally at bedtime. Titration. Increase in 0.1 mg per day, increments every 7 days until desired response. Doses should be administered twice daily, either split equally or with the high split dosage given at bedtime. Maximum dose 0.4 mg per day in 2 divided doses. What should I avoid while taking clonidine? Avoid drinking alcohol, it may increase certain side effects of clonidine. Avoid driving or hazardous activity until you know how clonidine will affect you. Dizziness or drowsiness can cause falls, accidents, or severe injuries. Avoid becoming overheated or dehydrated during exercise and in hot weather. Clonidine side effects. Get emergency medical help if you have signs of an allergic reactions to clonidine, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have severe chest pain, shortness of breath, irregular heartbeats, a very slow heart rate, or a lightheaded feeling like you may pass out. Common clonidine side effects may include drowsiness, dizziness, feeling tight or irritable, dry mouth, constipation, loss of appetite, or sleep problems, insomnia, nightmares.